Hi, I'm Dr. Rehan Umar, cardiologist by profession and a practicing diabetologist. World Diabetes Day is about to come on 14th of November this year, and unlike the common myth that we celebrate uh, the phenomenon of diabetes on this day, that's not the way, that's not the case. What we want to celebrate on this day, 14th of November, is how to make the general masses aware of the pandemic known as diabetes and how to tackle with it with precision, how to treat its complications, how to treat its symptoms, how to treat the adverse effects of medications and the indications of medications. We all know that diabetes is one of the most dangerous diseases, chronic illnesses in the world. After hypertension and after hyperlipidemias, diabetes has its role in causing more instances of stroke, heart attacks, heart failure, and peripheral vascular disorders. So, as a common layman, one should have slightest of the idea that if he or she becomes a diabetic, how would he be able to treat and tackle that disease? Diabetes is such a dangerous disorder from the cardiovascular perspective that being an interventional cardiologist, when we deal with such patients, when they land up with angina or heart attacks on the cath lab table, we find that these patients have more tortuous vessels, diffuse disease, more calcium in their arterial walls, and at times it becomes very difficult for us to put in a stent in those vessels. Similarly, if you refer those patients because of their adverse anatomy to the bypass surgeons, for them also it becomes quite difficult to put in a graft because the vessels are very diffuse and they are poor targets to put in the different grafts. So it all boils down to prevention. And for prevention, the first strategy is diet and lifestyle. So the diet should be meticulous in every one of us. We should forget about the process of urbanization. We should say bye-bye to fizzy drinks. We should say bye-bye to junk food, to McDonald's, to KFCs, to pizzas. Yes, the concept of cheat meal does stay, but only once in a while. Majority of the days we should diet properly. We should have adequate good quantity of good quality proteins, fibers, complex carbohydrates, fruits and vegetables, and ample amount of water. Also, we should have good, adequate, uninterrupted 8 hours of sleep. After diet, the next most important thing is physical activity. And yes, we should not neglect the importance of physical activity in any case. The American Diabetes Association, the American College of Cardiology, the European Association of Study of Diabetes, every different organizations have unanimously decided and have come on the same platform that every adult should undergo 150 to 180 minutes of physical activity every week, including moderate to severe activity, whether it be walking or jogging or running or gymming, swimming, whatever it takes. Go for it. Go for it. We fall down 7 times, wake up and stand up 8 times, just do your physical activity. Followed by pharmacological management, which is, it might be oral drugs or insulin. So whatever your doctor prescribes, try to follow those principles religiously. So this is how you manage the menace of diabetes, because diabetes is for us mother of all chronic illnesses. So once you have diabetes, you are more prone to develop heart attack, stroke, kidney failure, amputations, and different forms of cardiometabolic morbidities and mortalities. So please check your numbers, make a pledge to protect yourself from diabetes, and if you have diabetes, make a pledge to put your diabetes under control, make yourself stronger than diabetes so that the diabetes gets beaten and you end up being the conqueror. Thank you very much.